We'll look at the pathophysiology of chronic kidney disease, but this one is kind of like a special pathophysiology. We'll be focusing on the major consequences. So the major issues that a person with chronic kidney disease will have, how do these issues come to be? Okay, what are the sources of these issues? Okay, so for this one, we said that pathophysiology of major consequences in chronic kidney disease, it stems from the progressive loss of nephron function. That's like the overall root of this issue, is because you have a number of nephrons. All of a sudden, the number is going down. So the kidney is becoming incompetent. It can't actually keep up, you don't really have the mechanism enough to keep up. Okay, so if there's progressive loss of the nephron, it disrupts the kidney's ability to be able to maintain, regulating fluid levels in the body. Do you understand? So looking at the key consequences and their underlying mechanism, that's how they actually come to be. Uremia, so accumulation of nitrogenous waste products, urea and creatinine, will lead to what? Reduced glomerular filtration. So that's why the child will be weak, or that's why the patient will be weak, nausea, the skin is scratching, they are behaving psycho, and the heart can also become inflamed in the process. So it's the toxins that actually impair cellular metabolism and neurotransmission. Do you understand? Anemia. Erythropoietin is produced by what? Kidneys. If the kidneys are being damaged, erythropoietin levels is declining. So that will lead to what? Low red blood cell formation. Alright? This will lead to fatigue, pallor, reduced exercise tolerance. Mechanism: erythropoietin deficiency leads to reduced red blood cell production, uremic toxins. Okay, this will also shorten the red blood cell life. The mineral and bone disorders. So impaired phosphate excretion, reduced vitamin D activation, secondary hyperparathyroidism. Okay, effect is bone pain, fractures, vascular calcification. So hypocalcemia and hyperphosphatemia stimulate parathyroid hormone, so causing bone resorption and calcific deposition in vessels. The cardiovascular disease, causes all this hypertension, dyslipidemia, vascular calcifications, chronic inflammation. Of course, there's increased risk of heart failure, myocardial infarction, and also stroke. Okay, the electrolyte imbalance. Markedly, there's what? Hyperkalemia. Okay, so of course it's an acid, so having acids in the body. Okay, so fluid overload is impaired sodium and water excretion. All right, so it will lead to edema, okay, pulmonary congestion, hypertension. The neurological complications is due to all those toxins and electrolyte imbalance. So they are the ones that will ultimately lead to nervous system issues, because your nerves are becoming what? It's like they are becoming poisoned, they are becoming intoxicated. Okay, so that's for the various complications we have in chronic kidney disease and their various mechanisms.